Some parents are pulling their adult children out of state-licensed behavioral health homes, claiming the state isn't doing enough.
And it's actually a phenomenon advocates call mom dumping, and that's when families take on caring for the seriously mentally ill. The I-Team's Erica Stapleton dives into why this is a problem.
For years, the I-Team has exposed bad outcomes from gaps in Arizona's mental health care system, from homelessness to incarceration to violence, even death. Some parents will do anything they can to help their adult children who are among the sickest, and they want the state to step up too. It's not always easy.
I don't see him, guys.
For Seetha DeMarco to keep an eye on her son, Joey.
So he's only allowed to walk in the neighborhood.
If she's not out searching for him.
And I told him that he needed to stay in this park area.
She's searching for answers as to how she can help him.
And this is something I typically have to do.
Joey is 25, but Seetha is his legal guardian. He receives treatment for a schizophrenia spectrum disorder and gets state benefits for a serious mental illness.
And someone's not treated with these types of diagnosis, it's very dangerous.
He lives with her full-time in the East Valley, even though at one point, back in 2019,
he was floridly psychotic. He thought the Mexican mafia was after him. He had gotten a hold of a gun, and he forced both me and his 16-year-old sister out of the house. And I was terrified to call the police because he had a gun. And I thought, they're gonna kill him, but I did. I called the police.
Joey was arrested, released, and eventually became homeless. It took Seetha months to find him and to try and help him. Later, he started receiving treatment and tried 2 different state-licensed behavioral health homes.
The clinic was not coordinating care with the staff as they should have. There was minimal consistency with medication, and it was just a horrible mess. His nails had grown to the point where they were daggers. He wasn't receiving that level of support or even close to it.
When all of Seetha's complaints to the state went unanswered or unfounded, she decided to take Joey in with her. That, she says, was about a year ago.
Do you feel safe with your son at home?
His heart and soul, I don't believe that he would ever hurt anyone. The mental health, the psychosis changes people. Parents do get killed, and it's scary.
Moms have become the new asylum.
Beth Para is a member of Arizona Mad Moms, a growing group pushing lawmakers in part for better services and more oversight when it comes to Arizona's behavioral health care system, which she's navigated extensively with her own son, Nick.
We call it mom dumping.
Mom dumping, when families are taking in their loved one with a serious mental illness because services from the state aren't working for them.
These people are going to be in jail or homeless or dead.
Beth's son also lives at home with her after she pulled him out of a state-licensed home.
And they count. They matter. My son matters.
In the past year and a half, the Mad Moms group has grown to more than 500 parents, siblings, and caretakers of a loved one with a serious mental illness, many of whom say they've experienced some form of mom dumping.
It's because there's not enough funding, because they don't really believe people are going to get well, and they see them as throwaway people.
She's seen firsthand that there aren't a lot of places for someone with a serious mental illness to go. According to a 2024 report from Axis, the housing waitlist for someone with a serious mental illness was more than 5,000 people, the majority of those people on the waitlist for a year or longer. There aren't always enough psychiatric hospital beds for the sickest patients, and Arizona does not have any secured residential facilities.
I have made serious concessions for him, to be able to stay home and be safe. I work from home and don't make very much money at all. And it's changed our life significantly. It's very, very stressful, and it can be scary sometimes, but there isn't another option.
Seetha's search for answers has gone beyond filing complaints. She's brought her concerns to the Capitol.
It's like being made to watch a train wreck.
The bottom line, there aren't enough resources or safe housing options to help everyone who needs them most.
The services and care that my son needs on a daily basis doesn't exist.
On this day, Seetha found Joey back at home after he'd gone through another door. Her search for any other solution still at large. Axis declined our request for an interview for this story, but I did put in a records request with the agency specifically looking at fraud when it comes to the behavioral health care system. Those results coming up Friday from the I-Team. We're in the newsroom. Erica Stapleton, 12 News.